Good morning and welcome to our session. The name of our session is The Red Flags of Elder Abuse, Recognizing the Signs and Taking Action. My name is Tova Kasdan and I'm the director of the Elder Safe Center at Charles E. Smith Life Communities in Rockville, Maryland. I'm pleased to be your presenter this morning. Throughout the presentation, you're welcome to write your questions in the chat and we'll be able to answer them at the end of the presentation. We have limited time today, so I'll be sharing my contact information with you in case you'd like to reach out to learn more after the session is over. So let's get started. First, let's go over our learning objectives this morning. First, we're going to learn the definition and forms of elder abuse, including who commits the abuse and in what setting. We're going to identify the warning signs of elder abuse and how to report it to authorities. Lastly, I'd like to share community resources with you so you will be able to have them to assist elder abuse survivors. So in getting started, I'd like to make sure that we're all on the same page in understanding what is elder abuse, neglect, and financial exploitation. The definition is very broad. It includes physical abuse, sexual abuse, psychological abuse, as well as neglect, abandonment, and financial exploitation. All of these forms of abuse, neglect, and financial exploitation can be committed against an older adult. And it's important to understand that many forms of abuse are co-occurring. So it's not just one form of abuse or another. Unfortunately, many of our cases feature multiple forms of elder abuse, and they can be committed by multiple perpetrators. There are many myths that elder abuse only happens in certain settings like facilities, but that's actually not the case. Most elder abuse is committed at home by someone who knows the older adult. But of course it can happen in any setting, home, community, or facility. And the key to understanding this topic is to know that there's a relationship of trust between the older adult and the perpetrator. Sometimes that trust is long established because the older adult, let's say, is married or dating their perpetrator. Other times it could be a newer relationship or friendship, or sometimes even scam artists can establish friendships very quickly with an older adult, allowing them to perpetrate this abuse, neglect, or financial exploitation. Older adults, unfortunately, are sometimes the targets because they may be having mild cognitive impairment or another disability which lends them more vulnerable. But of course, this type of abuse can happen to anyone. I'm going to go through the different forms of elder abuse. And for time reasons, I'm not going to go through all of the bullets, but really highlight how this looks different in the older adult population. First is physical abuse. Many people, when they think of elder abuse, think that it can only be physical, but that's not the case. However, when physical abuse is occurring, it's quite serious. It can cause pain, harm, or physical injury. But please remember, you don't have to have physical injury in order to have established elder abuse. Older adults can experience kicking, hitting, pushing, slapping, or pinching by their caregiver. Inappropriate use of medications or physical restraints can also be considered physical abuse. You can also perpetrate physical abuse without touching the older adult. So let's say you have control over their assistive devices, whether that be a hearing aid, eyeglasses, or a walker. If the older adult needs that to be able to move about and engage in their activities of daily living, and you're controlling that, you are physically controlling or abusing them. Of course, there are different type of misnomers for physical abuse. So someone will say, well, it maybe not be abuse, but they were just handling them kind of roughly. But that is abuse. Anytime that an older adult is not being cared for in a respectful and professional way is physical abuse. During this time of COVID-19, we're also seeing enhanced abuse as it relates to either threatening or exposing an older adult to COVID-19 or not respecting social distancing in order to protect their health and safety. The next form of abuse is psychological abuse. Psychological abuse is really the bedrock from which all forms of abuse spawn. The reason I say that is if someone is not feeling emotionally safe or they're fearful of someone in their life, then they may be doing things that they don't wish to do, but feel like they have to do in order to, keep the peace and protect themselves. So older adults can be psychologically or emotionally abused by having someone insult them, humiliate them, ignore them, treat them like a child, use any kind of abusive language that is not appropriate. And certainly in terms of isolation, which is really key during this time of COVID-19, not allowing them to connect to family or friends, even if that visit is virtual. It is so essential that older adults are surrounded with caring people in their lives, whether that be family or friends or people in their faith community. And if they don't have that, then we have, opportunities for people who don't have their best interests at heart to move in and, hurt them in some way. So we want to make sure that older adults are feeling psychologically and emotionally well. The next form of abuse is sexual abuse. This is often a hard topic to discuss, but it is important to realize that we're not talking about consensual sexual relationships when we're talking about sexual abuse. We're talking about a non-consensual sexual act, and that could be perpetrated by, again, someone who they're married to, someone who's caregiving for them, or a stranger. While of course it can involve improper touching, it can also be forcing an older adult to view pornography, taking photos of them, and we've seen this in some of our cases without their permission if they're in a compromising state, and inappropriate sexual comments. All of these comprise sexual abuse. Next, we have financial exploitation. This is so significant. Almost all of our elder abuse cases feature a form of financial exploitation. This is the misuse of another person's money, property, or resources for self-gain. And this, can sometimes be blurred, the lines between what is appropriate and what is not. I'll let you know though, suppose that a caregiver has the authority to go grocery shopping for the older adult. And yet when they use the debit card for that purpose, they then, let's say, take out additional cash for themselves and buy food for themselves. That is financial exploitation. They did not have permission to use the older adult's assets in that way. So it can be, literally the stealing of money, let's say, cash on the table or in the bedroom. It can also be the unauthorized use of financial resources, as I've described. Someone who may be in a compromised state because of their mental health or capacity, if they're presented with paperwork and they don't have the legal capacity to sign it, yet someone forces them to do that, they may be making, decisions that they don't have the legal right to make and experience some severe financial consequences, like losing their home or their bank account assets, something like that. So we do want to be on the lookout for financial exploitation, which is very common. Neglect is our next topic. Neglect is the willful deprivation of one's basic needs. That can be food, clothing, shelter, medicine, or not caring for someone, which allows them to have good personal hygiene. This is very common when neglect occurs, and sometimes there is difficulty in reporting because let's say a daughter is caring for their mom and the daughter comes, let's say 3 times a week with meals, but the older adult is really bedridden and can't get out of bed. That may not be enough care to make sure that the needs are met. So even though someone is helping some, if they are not helping at the level in which the older adult needs to be healthy and safe, then it is neglect. So sometimes people will say, well, someone's trying their best. It's hard because she has to work. Well, then more care needs to be brought in the home because neglect can have dire physical consequences on an older adult's health. We have self-neglect as our next topic. Self-neglect is when someone should be able to care for themselves, but they're not able to do so for various, let's say, mental health or other reasons. The picture you see on a screen is of hoarding. That is a very common form of self-neglect. You might have someone who's also self-neglecting in that they're not taking themselves to the doctor when they should, they're not keeping themselves in a hygienic way, and they're unable to, let's say, manage their finances. So things are really falling apart around them. It's important that we connect older adults who are experiencing self-neglect to help. While I know sometimes many older adults have capacity, yet they're unwilling to change their living situation, which can be a really hard barrier to overcome, we still want to make sure we're doing everything we can to make sure that older adults are not self-neglecting. So we've just discussed all the forms of elder abuse, neglect, and financial exploitation. And together, it's a really large problem in the United States. Nearly 5 million individuals every year will experience a form of abuse, neglect, or exploitation. It happens to 1 in 10 older adults living in their homes. But the reporting is really low. And you see this iconic picture of, the surface of the iceberg, and only the tip is, peeking out, and that's what is being reported. But the large problem of what's not being reported, the hidden part, is underneath the surface. And it's very difficult. We're going to talk a little bit about why that is that older adults may not report, or the people around them, but we have to change these reporting numbers. Right now, for physical and sexual abuse, it's 1 out of every 24 cases that's reported. For financial abuse, it's 1 in 44. And with those kind of reporting numbers, it's really hard to make a dent in helping older adults in this situation. So we really need everyone to be a first responder, and if something's not right, report. And we'll talk about mandatory reporting in a little bit. The reason why we want to report is not just because we want to keep statistics on elder abuse, but because older adults who experience elder abuse are 300% more likely to experience a premature death. The mental health consequences are significant. Older adults experiencing elder abuse are depressed, have anxiety, increased mental impairment, maybe socially isolated. They're 3 times more likely to be admitted to the hospital and 4 times more likely to be admitted to a nursing home. We also have a situation where older adults who are losing their assets due to financial exploitation have a greater reliance on social and governmental programs. And that's a really hard position to be in. Older adults may be saving their whole life for retirement, and then it only takes, 1 occurrence or a pattern of older adults being exploited by family or scam artists, and they could lose everything. Losing financial resources does affect the physical and financial well-being of older adults. So this is all related. We want to protect older adults, not just for their physical and emotional health, but also because they need these financial resources to age safely in place. So you may be wondering at this point, okay, this sounds like a very serious issue, but who is it that's really perpetrating this elder abuse against older adults? For many people, it's hard to wrap your head around why anyone would harm an older adult. And as I mentioned before, unfortunately, it's usually the people closest to the older adult who are perpetrating the abuse. 2/3 of elder abuse is committed by family members. That could be an intimate partner, an older adult child, niece, nephew, grandchild, anyone in the person's family orbit. So it's really hard to identify sometimes because it's the person that the older adult may be most reliant on who ironically is committing this abuse. It can be a paid caregiver, a professional. So just because a professional has a license as an attorney or financial planner or social worker doesn't mean that they're exempt from committing abuse, neglect, or exploitation. So we always have to be on the lookout for that. Could be a neighbor, a friend, a stranger, someone who is in their faith community. So really anyone and everyone could be someone who commits elder abuse. But by the same token, looking at this on the flip side, these very same people in other instances are the lifeline for the older adult who do provide good care, and provide a healthy and safe living environment. So that is why this issue is very difficult, because sometimes the people closest to older adult are their best advocates, and sometimes they're the worst enemies. So what we need to do is understand what the warning signs are, so we know how to protect older adults and not just assume that because someone's living with them, everything's okay. So getting to that topic, a lot of people say to me, okay, I really want to learn how to identify when elder abuse, neglect, or financial exploitation is occurring. And while we do have some guidance for that, and I've listed that on this PowerPoint slide, this is not color by number. This is more of an art than a science in identifying this. And many of us who have spent our careers in the anti-violence field know that in some cases, some things may look one way, in another case, they may look another way. So we're not expecting you to be the expert, but to learn some of the signs. So if you do think an older adult is at risk, that you take the opportunity to report that to the authorities. So I'll start with what I think is the easiest, which is unexplained or untreated injuries, okay? So a lot of people, and I'm a lawyer by training, I'm a former prosecutor, want to see where are the injuries, show me the injuries. As we talked about before though, there may not be injuries, or the injuries that do present, perhaps the perpetrator is explaining them away. So maybe they're saying that the older adult fell down the stairs, or they fell out of their chair on their own, or something like that. But really, that's not at all how the abuse occurred. There's been some research that identifies that abuse happening on the upper torso, the face, the hands, those are more indicative of forms of abuse. Again, we're not asking you to make that determination, but get this case to the authorities who can do the investigation. We also need to look for clues in the older adult's emotional well-being to understand what's going on in their lives. It's very rare that someone will make a disclosure and, you'll walk in the room as, let's say, the care giver in a facility, and they'll say, I want to share with you that my daughter's abusing me when she visits. Like that does not happen, but we have to look for clues. Are you noticing that when a family member visits, that the older adult in your facility has increased anxiety or fear? Maybe, it's their body language. They curl up more, or they don't want you to leave the room, or they don't look forward to the visit. Those are some of the signs that you want to keep an eye out for. Certainly a change in depression or anxiety. Again, this idea of isolation is very important. Is the older adult being disconnected from their communities in ways that are ties that are very important to them? Sometimes abusers will try to disconnect them from friends, family, and other folks so that they can't report. Are you seeing signs of malnourishment or dehydration in the older adult? So maybe if they're living at home, they don't have the proper access to food that they need. So that is a form of neglect, as we discussed. So we want to not just let that go. That can have dire health consequences on the older adult. Again, poor hygiene of self or setting. And is there a change in their capacity where now they're not able to handle their financial affairs and someone is moving in to help them but may not have their best interests at heart? These are some of the things that you want to look out for. And of course, during this time of COVID-19, this makes our job even more challenging, as we want to make sure that older adults who are now maybe not getting out as much, maybe senior centers are closed, adult daycares, places of worship, maybe they're not seeing their doctors for preventative care. We have to do more to reach out to them to make sure that they're safe and healthy. And one of the challenges right now is, do we have the community capacity to do that? Who is calling that person, whether it's a senior check, a caring member of the person's, senior community, something like that, to make sure that the older adult's okay. It's imperative that we do that, as older adults may not be able to get to transportation on their own now, or they're not comfortable or are not experienced in accessing technology. So for example, in an effort to outreach to the community at our Elder Safe Center, our community educator isn't just hosting Zoom educations, but also just old-fashioned wellness group conference calls once a week in case the older adult doesn't have access to the internet, that they're able to talk about issues that are important to them. So what I'd like to do now is really put all of what we've learned into, real life. And I'd like to do an interactive case with you, and I encourage you to put your thoughts in the chat at this time. I'm going to read you the scenario, and then please do answer the questions as I read them to you. Betty lives in your senior community where you work. She's in her late 80s. And while she lives alone, she has a son who lives nearby and visits from time to time. A few months ago, Betty was unfortunately scammed by a stranger on the phone who tried to sell her, and successfully did, a COVID testing kit. She lost $500. It was at that point that her son, who's the power of attorney for her finances, stepped in and said, "That's it, I'm gonna take control, I'm gonna manage your bank account. Since you've been scammed, we need to protect your assets." She's very thankful that she has a son who's able to help her. However, when you checked in on Betty, you've noticed that over the course of the past few months, she told you that she doesn't really connect with her friends anymore. And while before she didn't have problems buying groceries, now she says she doesn't have enough money to do so. When you try and find out more details, she says, "It's okay, I have what I need." So I have a couple of questions for you. First, would you inform the son of your concerns? Secondly, would you call Adult Protective Services? This is a tricky situation. While on one hand, you might want to reach out to the son to express your concerns, the red flag that may be popping up in your head right now is if the son is a perpetrator and is financially abusing his mom. Now remember, more than one person can do that. She may have been scammed, and the son, in an act of seemingly goodwill, is taking over her finances, but he may be using her finances for another reason. So very important to recognize that you may want to reach out to son, but that may not be a good idea in terms of Betty's safety. So would you call Adult Protective Services? You have an older adult who has been scammed. One question would be, what is her mental capacity at this point? But if you in any way think that she might need additional services, or that her son is depriving her of what she needs, you can never go wrong in reaching out to Adult Protective Services. You may also want to reach out to the supervisor within your senior living community to discuss concerns and next steps. So how do you start the conversation? What's really important when we want to talk to an older adult is not just what we say. And remember, we always want to be active listeners. We don't want to put our own judgment or say, "Why did you do that?" into the conversation, but make sure that it's literally a safe time and setting for the older adult to talk. So if you start this conversation and call someone up and say, "I want to talk with you because I'm worried about, your affairs and all of that," and you just jump right in, and maybe they have the caregiver sitting next to them who's actually perpetrating the abuse, they may deny this and try to get you off the phone quickly because it's not a safe time. So first and foremost, is this a good time to talk? You may want to start off with just, I know the pandemic has been really difficult for everyone. How have you been? Do you have any concerns? So just open-ended question. Or, reaching out and saying, "I've been concerned about you lately. You seem somewhat sad. Is something making you feel that way?" And just start the conversation out of concern, but not judgment. So what's really important is you don't want to make assumptions. You don't want to say, "Oh, isn't it great that your daughter lives with you and can help you with your, grocery shopping," or something like that, because maybe that isn't a good thing. So what we want to make sure is that we're letting the older adult tell their story, and we're here to assure them that everything they tell us, we're not judging them, we're here to listen, and that we're here to provide resources. And if you're listening and detect and identify that there may be abuse, you may be obligated to report this to Adult Protective Services. And we're going to talk about that next, which is who is obligated as a mandatory reporter. Remember, Adult Protective Services is a government agency serving older adults with disabilities who are in need of assistance. Their job as a government agency is to investigate cases of abuse, neglect, or exploitation, assess the individual's unique needs, and develop a service plan to maintain the health and welfare of the older adult. These laws vary by state. I'm just going to focus on Maryland for today, but please know if you're a mandatory reporter and let's say you serve older adults in multiple states, the laws are going to look different in each state. In Maryland, a vulnerable adult is someone who's 18 years of age or older with a physical or intellectual disability that impairs their ability to be independent or provide their own self-care or protection. So not every case is an Adult Protective Service case. So for example, in Maryland, if you have two 65-year-olds living together, a husband and wife, let's say, and there's no vulnerabilities on the wife's part, but it's long-standing domestic violence, you can offer resources to her if she would like to leave and connect her to agencies in the community that could assist. But if she doesn't have a physical or mental impairment and is not ready to leave that relationship, then that is not an Adult Protective Service case. But I always encourage, when in doubt, to reach out, because even if they can't assist you in an investigation, they may be able to connect you to resources to assist the senior that you're concerned about. So how do you report to Adult Protective Services? I've listed on the screen the numbers for our region, for Montgomery County, all Maryland counties, DC, and Northern Virginia. A lot of times, the intake person at Adult Protective Services is going to ask you some basic information, the name, the age, the address of the older adult where you're concerned that abuse is taking place or neglect or exploitation. If you don't know the answer to any of these questions, that's okay. You just give them what you know. You want to talk about what is the nature of the older adult's incapacity. So for example, if the older adult you know has a diagnosis of severe dementia, you want to mention that in the reporting. You want to talk about what is the reason you're calling in as many details as possible. This is not a time to be shy. If you know that an older adult doesn't have access to the amount of food that they need or healthy drinking water, or they're being prevented from going to the doctor, you need to say that. Of course, if there is imminent harm or risk, you want to call 911. And please understand that if an older adult is suffering, and it doesn't have to be that, you know, they're on death's door, but if they don't have enough access to food, that is an emergency. So please do call. Our next topic is who can assist and who must report. Anyone, whether you're a mandatory reporter or just someone who is concerned, can call Adult Protective Services. So I'm going to repeat that because it's really important. Anyone can call Adult Protective Services. You can even call them anonymously if you don't want to give your name. Every report, whether you call anonymously or you give your name, let's say you're working at a facility and you say, I'm calling because I'm concerned when the daughter comes, I've seen her, you know, slap the older adult. You can expect that every report is confidential. And by that, what I mean is Adult Protective Services is then not going to say to the victim, we're reaching out to you because so-and-so from this facility called because they witnessed your daughter slapping you. They're not going to say that. It's confidential. So please know that. Mandated reporters, again, this varies by state. In our state of Maryland, anyone in the healthcare profession, physicians, nurses, social workers, psychologists, administrators, first responders, police, firefighters, any medical or mental health worker, human service worker, it's quite broad. So again, if you're on this list, you must report in Maryland. If you're not, you can still report, and I would urge you to report. And anyone, whether you're a mandatory reporter or not, can report anonymously, and every report is confidential. In our remaining moments, I wanted to be able to offer some resources. So if you do make a report and you're concerned about an older adult who's at risk, know that there's help in your community. I wanted to tell you a little bit about our Elder Safe Center. Our center was established in 2014, so we'll be celebrating our 6-year anniversary. We provide safe shelter to older adults who've been abused, neglected, or financially exploited. And we cover all of Maryland, DC, and Northern Virginia. We're located within Charles E. Smith Life Communities, which is a senior living community, which has many different levels of skilled care, independent living, assisted living, subsidized living, memory care. So we have lots of options on our campus. If someone calls our helpline and wants to make a referral for an older adult who needs temporary shelter to escape the abuse or neglect or exploitation, they can be assured that the older adult will receive all the necessary care in our facility. We have a language accessible helpline, which is open Monday through Friday, 9 to 5, and our program manager, who's a licensed clinical social worker, manages the helpline. Again, we receive calls for folks who need shelter. So we might receive a call from another assisted living, from adult protective services, from a domestic violence program, from a senior center. Anyone and everyone can call us. Sometimes folks don't need shelter or they're not ready to leave, but they do need resources. So rest assured that if you call our helpline and you need resources, like where do I go if the older adult wants X, Y, or Z, you can ask us that too. We are not a government agency. We do not do the investigation, but rather we're a hub to be able to assist with resources. And if those resources include safe shelter, we're able to shelter the older adult within our facility. So in shelter, the older adult receives all the services that any of our residents on our campus receive, plus some trauma-informed services. So that includes medical, psychological, physical therapy, occupational therapy, speech therapy, spiritual support, legal referrals, and specialized trauma therapy to work through the issues of abuse, and also to provide trauma-informed yoga, music, and art, which has been incredible, especially for some of our clients who have mental incapacity or impairment and are not necessarily good candidates for talk therapy. We find that the holistic therapy really is incredible in the healing process. So our survivors are well cared for in our shelter, and we are working with them to give them all the services that they would like or their guardian chooses for them, and also to work on a safe discharge. What I've done is I've listed the names of all of our team members from Elder Safe. And as I mentioned before, I'm Tova Kasdan, I'm the director, Carrie Ann Alabar is our program manager, and Sydney Palinkas is our community educator. Aside from Safe Shelter, we host a robust community education program. And this time of COVID-19, every week we're busy hosting community education, and we're very happy to do that. If you or your teams would like to be educated further on recognition of elder abuse or other topics related to abuse, neglect, or exploitation, all of our education is free, and we can plan that with you for your teams or for your community. So please do reach out if you'd like education to Sydney Palinkas, our community educator. We also have wonderful resources on our website, our brochures and community resource guides, and I've listed our website below as well. So we hope that you'll reach out to us and stay connected. So please, if you have questions, put them in the chat. If we don't have time within the last 5 minutes to answer all of them, I'll be sure to reach out to you if you put your contact information and answer any remaining questions. I want to thank you so very much for spending this hour with me, and know that we're partners in prevention of elder abuse, neglect, and financial exploitation, and we look forward to staying connected with you. Thank you very much.